little manip here and mobilization or soft tissue there, plus maybe a stretch, and they're out the door. I recently heard a physical therapist describe this as their treatment approach. Manip is short for manipulation, like what chiropractors do, whereby a joint is forced back into place and usually is followed with a satisfying crack of the joint. Mobilization is essentially getting a joint moving better, usually in a certain direction. And soft tissue refers to massaging or working out knots in muscles or tendons. Patients keep coming back, so we must be doing something right, he then said. This was a seasoned PT who has a very good reputation, and this approach may solve simpler problems, at least for a little while, perhaps even a year or even longer. But in my opinion, this highlights how far we've gone off track with patient care for more chronic pain. Because a patient keeps returning for treatment isn't always a sign that a therapist is doing something right. Instead, it's a sign that the therapist perhaps alleviated symptoms, at least temporarily, and at least isn't hurting the patient more. It's often akin to stretching the hamstring muscles in the back of the thigh to fix sciatic pain. Yes, it feels good temporarily, but is it solving the reasons the patient is having sciatic pain in the first place? Probably not, unless the therapist is also addressing why the hamstrings seem to be chronically tight in the first place. In my opinion, this isn't caring for a patient. Instead, this is treating a patient. Caring for a patient means you're digging deep to understand and solve all the reasons that person is having pain, with the goal of solving their pain expeditiously and permanently. Treating a patient is essentially applying treatment to alleviate their immediate pain. I describe this as component thinking, where the main consideration for treatment is in the immediate zone of pain. While the patient may be happy or grateful for this, it often doesn't go far enough to solve the problem. So the patient returns for another appointment. Wash, rinse, repeat. But it doesn't have to be this way. I would encourage health and wellness practitioners to instead think from a systems standpoint. One where all the problems feeding that zone of pain are understood and resolved, thereby solving the pain completely. This is more fulfilling from the patient standpoint and the therapist standpoint because results are seen quickly, almost miraculously in many cases, as well as permanently. This is the approach I've developed and teach. It's why our clinic business grew 4 times in just a few years with no marketing dollars spent at all. Word gets out. Please click the link above or below to learn more.